Welcome, Joe, Minister, to our conference. I'm very happy that you could make time for us to speak to our members and all the attendees. I'm just handing over to you. And there's so much going on, obviously, Joe. And, I know that, we have a short period of time to discuss things, but yeah, it's just pharmacy has been really busy over the pandemic time, and our members have gone over and beyond, and then having you addressing the conference obviously means a lot.
Well, thank you, and thank you for asking. I was really pleased to be able to speak today at the Association of Independent Multiple Pharmacists. I know it's virtual, and I think given how busy everybody's been, there will be some joining us who actually think that they're here because it is virtual. So I think we have to take the positives where we can. So I would like to thank you, Lena, for everything you do as Chief Executive, and for the warm invitation. I know you are phenomenally busy. These are completely unprecedented times, and COVID has had a big impact, a huge impact on community pharmacy. However, it has also provided opportunities. I think now more than ever, people recognise how valuable community pharmacy and their local pharmacy is, what an asset it is, and what a valuable and approachable part of the NHS it is, and how important it is in all of our lives. I suppose my first thing that I'd like to say is just a huge thank you for the hard work. And I'd like to extend that to the whole team, because I know for many pharmacists, when I'm in stores and things, actually it's more of a family. There is very definitely that feeling of people supporting each other, and during the pandemic we are living through unparalleled times, and I know that the overwhelming contribution that pharmacists, pharmacy technicians and their teams make in challenging circumstances, in my view, deserves more recognition. Your resilience, your determination throughout the pandemic, the way you've stood up, has just been absolutely outstanding. Community pharmacy has faced an enormous increase in its workload during the pandemic, with more use of people utilising the important services that you provide, that timely, safe supply of medicines, the health advice, how important you've been in the face-to-face, hands messaging to people about cleanliness, the health and well-being support, and that increasing number of clinical services, and the way you've stepped up to help shielding patients and the clinically extremely vulnerable was just unbelievable. The strenuous circumstances faced by all parts of the health sector as a result of COVID have led to all community pharmacies, including independent multiples, providing a guiding light, I think, at the heart of their communities. I mean, the pandemic has only reinforced the importance of community pharmacy as part of, but within, the broader health service. I think the association's campaign to recognise the contribution of pharmacies earlier this year shed a really welcome light on what heroes you have out there, and how they go the extra mile to help their patients. So I both congratulate you, but also want to share in really recognising those individuals who do so much. But since the start of the pandemic, I mean, community pharmacies have risen to the challenges, and I know you will continue to do so. But I also know that everybody is tired, really tired. This has been a really hard year. And although COVID infections across the country are mostly declining, and countries moved out of the second lockdown, we know we've all got to stay vigilant and continue to work together as much as we can to ensure that patients can access services they need as safely as possible, whether they have COVID symptoms and they need directions and so on, or they have other health needs. With thanks to scientific advancement, we're in a much better position than we were at March of this year. And I'm actually talking to you on the day after what has been a very exciting day for any of us who admire science and the developments of medicines and vaccines and things. So we are in a better position. We better understand the disease, how to treat, how to isolate patients. And there's been a huge effort to adapt to COVID safe working practices in store and when dealing with both customers, but also when working with each other. I know that community pharmacies' experience during COVID has been that you've stayed open throughout, which has been amazing. You've provided that accessible, safe, open, secure space for staff, patients and the public. And you have also put your local business continuity plans in place this time round. But every time there's more to think about, there's more to do, there's more in running the business and in the front-facing element of dealing with customers and patients. The department and NHS England and Improvement, in collaboration with the sector, made changes in order to support your work, and I hope you found that beneficial, and those will continue to help through the winter. And it has been very much a real-time example of how things can be done. So I'm thinking of flexible opening hours, online consultations, the enabling of enabled by verbal consent. And I know that many independent multiples want to be able to set up online to increase patient choice, improve efficiency, and so on. The patient quality scheme has also incentivized community pharmacies to make their premises COVID secure and support the individual risk assessments. Particularly important, a high number of BAME staff within pharmacy, and it's really important that we're looking after each other as well as we can. Also making sure that you can order PPE requirements through the e-portal as well. I engage with frontline community pharmacy staff regularly, together with national bodies for pharmacies, pharmacy technicians and pharmacies, about what can be done to support you. Sometimes actually it's quite simple things. Some of the things are bigger, longer term, changes to the way education happens on your journey to be pharmacists or technicians. But I'd really, really welcome your feedback, Layla, from the conference and from your thoughts from the AIMP on those key messages that I should consider. My door is always open. I am a great admirer of what the pharmacy sector does, but I can only learn if people help me understand what the challenges are. So the challenges we've got at the moment, flu vaccine obviously is being rolled out, and shortly the COVID vaccine, with flu vaccines for the over 50s and vaccination more important than ever before. The role that community pharmacies always played in the flu vaccine program, I don't need to tell you, has been vital, and this year it's increased again. You've risen to the challenge and vaccinated more people than ever before. By this point in the year, you have vaccinated more individuals than you did in the whole of last year, which is incredible. And with your help, I want to be able to reach as many of the priority cohorts as possible and reduce the pressure on other parts of the health system, because this really is a team game. I'd particularly like you, and I know lots of pharmacists are already doing it, but to reach out to social care workers, make sure that you've helped identify slots for those individuals who are caring for the most vulnerable in our society. Any schemes that have worked locally, where you've worked with care homes or providers or anything that you'd like to feed in and tell me about for consideration on a wider scale, please let me know. Come and talk to me. Nobody in this world has all the good ideas, for sure, and there is some brilliant work going on out there, but we really need to make sure that we get to the vulnerable cohorts. You will also have seen NHS England's plans for the rollout of community pharmacy in the COVID vaccination programme, and you have an important role to play in this, either working with those GP practices within your local PCNs, primary care networks, or running pharmacy-led designated vaccination sites. Now, the latter is not going to be possible for a lot of community pharmacies generally, given volume, difficulty with sites and so on. But I know that several independent multiples are progressing applications, and, you know, I am keen to support pharmacies and pharmacists, including the independent multiples, give out as much information and to help the population be assured of the positivity of vaccinations, because you are trusted, knowledgeable individuals who understand the benefit of vaccines. And when people quite rightly want reassurance, I hope you can help advocate for its uptake, and help people understand and answer questions and provide that reassurance, because it really is a job for all of us. I mean, looking forward, the COVID has of course caused delays to the delivery of the community pharmacy contractual framework, to the 5-year deal, but I do remain committed to the vision that was set out in that deal. I mean, that vision of community pharmacy integrated in the NHS, delivering more clinical services, being the first port of call, raising that profile of pharmacy to where it should be, and taking pressure off other parts of the NHS, and utilising the knowledge and the skills, you know, a very, very highly skilled set of people in pharmacy, and making sure that all your skills and abilities are used is really, really important, in order to help the broader community, but also to give more satisfaction to people delivering roles. I know that many independent multiples are really, really keen to do more clinical work, and I am really behind making that happen. Some of the new services that we were going to implement have of course been delayed because of the challenge of this past year, because as you'd expect, we've had to reprioritise services that support the NHS in the fight against COVID. So, for example, GPs can now refer patients into the community pharmacist consultation service, and this will ensure speedy access and advice and medicines for patients with minor illnesses, reduce pressure on GPs whilst making the best of pharmacist skills. Now, I suppose one of the things everybody wants me to talk about is funding. I know there's concerns, you know, there has been real pressure, and following discussions with the PSNC, revised proposals are now being considered by the government for additional funding to meet those extra costs incurred by community pharmacy throughout the pandemic. I can't preempt the outcome, and given the current economic situation, the discussions will be tough, but I am fully committed and fight the corner of pharmacy at every opportunity I've got, explaining that the potential is actually part of this part of this equation of the cost, because how much more you are delivering, you can deliver if you are enabled. Now, I'd like to finish by stressing again the outstanding effort of independent multiples during the pandemic, how you have stayed open, how you've dispensed medicines, how you've provided that health advice, but more than that, how you've been a friend in the local community. Your teams have been phenomenal. They have performed a fantastic job on the front line during unprecedented times and scary times. You know, speaking to teams, particularly back in the early days, it was only 9 months ago, but in some ways it feels a lot longer than that. And people were resilient and were just phenomenal in the way they rose to the challenge of making sure that people who needed to access their medicines could still do that day after day. So thank you, Layla, for giving me the chance to talk to you today. Hopefully we will meet in person in the not too distant future. And I wish you all the success for the rest of your conference. So thank you very much indeed.
Thank you, Jo. That was great. Thank you. It's great to hear that you are a big supporter of community pharmacy, and you've seen, you know, how our teams have gone over and beyond over the past over the past year. Really, it's a year gone now, and you know, they continue doing that. I know you mentioned that obviously you can't go into the funding thing, and I'm not going to ask questions because obviously it is something that you discuss with PSNC, but obviously it's tough times out there.
Yeah, no, I appreciate that.
Yeah, we've had a conversation with Jesse Norman, the financial secretary, and he came to see a pharmacist, and I had a conversation with him as well just before the lockdown, the first lockdown, and he said to me that he really appreciates community pharmacy, and you know the Treasury see as well how the sector goes over and beyond. And in fact, Rishi Sunak visited one of our members not long ago in September, and he was also very, very positive. So I guess all we can say at the moment is fingers crossed, and it's good to know that you are fighting our corner. But our members desperately need that funding to function and survive. The other thing that I wanted to ask you, Jo, is about PCNs. Well, obviously there's been a lot of talk around PCNs, and one of the things that our members are worried about is the number of pharmacy teams that are losing to PCNs. And there hasn't been any consultation around that in advance. So all of a sudden, all this trained staff that community pharmacists put a lot of effort to train them, and they get to know the patients and so on, they then move into the PCN area, and that, you know, space is left, and it's very difficult to fill that by training of staff again. So what are your views around that? How can we kind of overcome these challenges with PCNs?
I think, you know, the first comment is that what it speaks volumes about is what a highly skilled element of the workforce you are, that you're in high demand. And I recognise the challenge that brings. I mean, I think the difficulty is we want to see pharmacists in PCNs, in GP practices, helping deliver optimum care, but we also need them in community pharmacies, and I recognise the challenge. I think we need to make sure the pipeline's good. There is a need to start to deliver more pharmacists through the pipeline. That's not something that you can do quickly. So I think making sure that we are alive to the fact that you are not taking from one service to put into another is important. I think secondly, as set out in the 5-year deal, by making the pharmacist role a more clinical one, so that pharmacists interested in that clinical facing role can find one both in general practice, but also in the pharmacy, in the high street, for me is really, really important. So actually, it's not a choice. If you want that sort of that clinical, that more the emphasis on more of a clinical role, you don't have to just look to one place. Actually, you can get what you love about community pharmacy and the clinical role. So for me, actually making sure that we drive those things forward is really important. And I suppose, thirdly, I would like a more cohesive sort of environment and collaboration around PCNs. In some areas, there are pharmacy leads in PCNs in the country, and that includes, I think that includes ensuring that everybody is working together in a different way to ensure that support and that collaboration and so on. Because, as I say, what you don't want to have is unintended consequences of pharmacists being taken from one place and just reallocated into another and leaving a void. So I think there is the ability to get the balance right, but I do think we've got to be careful. Is where I sit. Sorry, that was very long-winded.
No, that's absolutely fine. And the other question that I had is, obviously we want to be the front door to the NHS. Literally, we want to be that. But obviously, with the right funding and support and you know and believe in the sector, we could become that. How, obviously, you've been now a minister looking after pharmacy for 2 years.
It's about 18 months, but you take out you take out the time. You know, there've been unusual times.
Sure, but I
managed to get an election and COVID and various other things in those 18 months. So
from your perspective as a minister, so how close are we? How and what do you think in terms of, like, what is it that we could do as a sector, you know, change or that we could become truly that front door of the NHS?
So for me, it's making sure it's about recognition, it's about skills, it's about that 5-year deal, ensuring that better integration, providing more clinical services, making sure people think pharmacy first, being that first port of call for minor illnesses. I think we've got a way to go, if I'm honest. I was talking about how we can drive things forward in the education, but obviously, you know, there are regulatory approvals and all the rest of it that need to go with that. It also means making sure that the teams in the pharmacies are also being allowed to work at their optimal level. I think there's a piece around data and ensuring data flows and so on, and actual accessibility, which is important as well. We've seen how things become more fluid when we can allow you more access. I want to identify opportunities for community pharmacy at all levels. I suppose one of the big learnings is you're not all the same by any stretch of the imagination, and I am always very wary of just referring to you as pharmacy, because you are a collection under one banner, if you see what I mean. That makes collaboration across the piece, both centrally, I suppose, with DH and NHSEI, but also more locally in PCNs. I think it makes it absolutely vital that we're all talking together to make sure that we can deliver and that we can understand here those steps that actually enable you to get to where you want to be. And I would like to see a mutual respect amongst all professions, because everybody brings something to the table. You know, my community health services, those district nurses who are out there come rain come shine, who don't have that sort of body of people as you would do if you're in either general practice or at in the hospital, but playing a vital role looking after some of our frailest in the community. They use their pharmacies and talk really, really highly of them, making sure that we have that mutual respect across the piece for all the people who bring care to the nation, and that we collaborate to get the best for people is really my vision, I suppose.
Thank you. And my final point, because I know you're very busy and you have to dash off, Jo. The final point is, obviously, as a sector, and again from AIM's perspective, we really want to be involved in from the onset within the setting of strategy that affects the sector going forward. And I think when we are right from the beginning involved in it and can feed into it, it's much easier then to implement and move forward, rather than having something implemented on us without being involved in the process. So what are your thoughts around that? And you know, and I think we've seen some movements around this, but I think there's obviously room for more you know, involvement from the sector right from the beginning into, you know, setting strategies. So what's your thoughts around bringing pharmacy in early on within those sort of thinking before something is implemented?
I have heard, actually 18 months ago, I heard that I suppose that reference to being done to rather than being involved. Okay. I have really, really tried to reach out, have stakeholder engagements, both with those on the front line, but also with representative bodies and so on. And as I say, my door is open. I think it's vital, if you're going to get the most out of a service, that people are at least allowed to air their views as to why something might work, might not work, how it can be enhanced. As I said earlier on, nobody has the preserve on the good idea, and just sometimes, and during the pandemic, I remember a meeting, and it was a pharmacist who actually very gently said to another member of a different profession, "Don't write, we'll deliver," on the bottom of the script. We are there from 6 in the morning till midnight, trying to get everything out of the door. If I said you'll go to somebody's house, you wouldn't be that impressed. So this is about us working together. And sometimes I just think it's that, I don't think these things are always done consciously. I think they are done because there's perhaps not an appreciation of the jobs and the roles and the daily working life of others within the profession. So no, my door is open. Come and talk to me, Leila. Sure. You know, making policy is actually complex and difficult. It's a bit like knitting without a pattern on occasions. So do come and help me make that jumper.
Thank you very much.
I wish you a very good
Thank you. And it's great to know we have a friend of pharmacy in you, Jo. Thank you so much.
I think you are great. Take care and try and get some rest over the next few weeks, when hopefully things will be a little bit easier, because I know everybody is really tired. So best wishes and take care.
Thank you so much, Jo. Take care. Bye. Bye.